Question number 1. What is the primary purpose of aseptic technique in surgery? The correct answer is option A, to prevent infection. Question number 2. Which surgical instrument is mainly used for cutting tissues? The correct answer is option A, scalpel. Question number 3. What type of suture material is absorbed by body? The correct answer is option A, catgut. Question number 4. Which step comes first in the surgical hand scrub procedure? The correct answer is option A, removing jewelry. Question number 5. What is the main function of a surgical drain? The correct answer is option A, to remove fluid from the wound. Question number 6. When should sterile gloves be worn during surgery? The correct answer is option B, before touching sterile instruments. Question number 7. Which condition requires immediate surgical intervention? The correct answer is option A, acute appendicitis. Question number 8. When assisting in surgery, which area should the nurse avoid touching? The correct answer is option B, patient's skin. Question number 9. Which factor increases the risk of post-operative infection? The correct answer is option A, poor hand hygiene. Question number 10. When is a surgical count performed by the nurse? The correct answer is option A, before incision and after closure. Question number 11. What is the primary purpose of using a hemostat during surgery? The correct answer is option C, to control bleeding. Question number 12. Which type of anesthesia causes loss of sensation in a specific body area? The correct answer is option C, local anesthesia. Question number 13. What is the main function of retractors in surgical procedures? The correct answer is option C, to hold back organs or tissues. Question number 14. Which surgical dressing promotes healing by maintaining a moist environment? The correct answer is option C, hydrocolloid dressing. Question number 15. When should the nurse check vital sign after surgery? The correct answer is option C, frequently and regularly. Question number 16. Which surgical procedure is performed to remove the gallbladder? The correct answer is option D, cholecystectomy. Question number 17. When preparing an operating room, which area must remain sterile? The correct answer is option C, instrument table. Question number 18. Which post-operative complication involves blood clot formation? The correct answer is option D, deep vein thrombosis. Question number 19. What should be done if a sterile field becomes contaminated? The correct answer is option D, replace it immediately. Question number 20. When handling surgical specimens, what is the nurse's main responsibility? The correct answer is option D, labeling and sending to lab properly. Question number 21. What is the main goal of preparative nursing care? The correct answer is option A, to prepare the patient physically and mentally for surgery. Question number 22. Which solution is commonly used for surgical hand antisepsis? The correct answer is option A, pyridine iodine. Question number 23. What is the first stiff and wound dressing procedure? The correct answer is option A, hand washing. Question number 24. What type of surgery is performed to diagnose a condition? The correct answer is option A, exploratory surgery. Question number 25. What is the primary function of surgical sutures? The correct answer is option A, to close the wound edges. Question number 26. When should a nurse remove surgical gloves? The correct answer is option A, before starting the next procedure. Question number 27. Which position is used for perineal and rectal surgeries? The correct answer is option B, lithotomy position. Question number 28. What should the nurse ensure before transferring a patient to the operating room? The correct answer is option A, all jewelry is removed. Question number 29. When assisting in surgery, where should the scrub nurse stand? The correct answer is option B, close to the sterile field. Question number 30. What type of anesthesia is administered into the subarachnoid space? The correct answer is option B, spinal anesthesia. Question number 31. Which instrument is used to clamp blood vessels during surgery? The correct answer is option C, hemostat. Question number 32. What is the main purpose of biopsy surgery? The correct answer is option C, to obtain tissue for diagnosis. Question number 33. Which type of wound heals by primary intention? The correct answer is option C, surgical incision. Question number 34. What is the key sign of internal bleeding after surgery? The correct answer is option C, decreased blood pressure. Question number 35. Which of the following sutures is non-absorbable? The correct answer is option C, silk. Question number 36. When should the nurse position a patient in father's position after surgery? The correct answer is option D, to promote a lung expansion. Question number 37. Which surgical procedure involves removal of the uterus? The correct answer is option D, hysterectomy. Question number 38. When preparing surgical instruments, which step should be done last? The correct answer is option D, sterilizing. Question number 39. Which action helps prevent deep vein thrombosis after surgery? The correct answer is option D, encouraging leg exercises. Question number 40. What should the nurse do if a patient vomits after surgery? The correct answer is option D, turn the patient to side position. Question number 41. What is the primary purpose of using sterile drapes during surgery? The correct answer is option A, to maintain a sterile field. Question number 42. Which surgical team member is responsible for handing instruments to the surgeon? The correct answer is option A, scrub nurse. Question number 43. What is the main goal of post-operative nursing care? The correct answer is option A, to prevent complications and promote recovery. Question number 44. Which of the following represents a clean wound? The correct answer is option A, surgical wound made under aseptic conditions. Question number 45. What is the nurse's first action after noticing excessive bleeding from a surgical site? The correct answer is option A, apply direct pressure. Question number 46. When is a tracheostomy performed? The correct answer is option B, when airway obstruction occurs. Question number 47. Which factor delays wound healing after surgery? The correct answer is option B, infection. Question number 48. What should the nurse ensure before administering anesthesia? The correct answer is option B, patient is fasting. Question number 49. Which of the following is a common complication after abdominal surgery? The correct answer is option B, paralytic ileus. Question number 50. When assisting in surgery, how should the nurse handle sterile instruments? The correct answer is option B, with sterile gloves only. Question number 51. Which of the following fluid is commonly used for intravenous hydration during surgery? The correct answer is option C, normal saline. Question number 52. What is the purpose of using an electrocautery machine in surgery? The correct answer is option C, to stop bleeding by heat. Question number 53. Which part of the body is examined during a laparotomy? The correct answer is option C, abdominal cavity. Question number 54. What is the main objective of a pro-operative checklist? The correct answer is option C, to ensure patient safety before surgery. Question number 55. Which infection control measure is most essential during surgery? The correct answer is option C, maintaining strict asepsis. Question number 56. When is the best time to administer prophylactic antibiotics before surgery? The correct answer is option D, within 1 hour before incision. Question number 57. Which type of surgery is performed without prior planning in emergency conditions? The correct answer is option D, emergency surgery. Question number 58. What is the nurse's immediate action if a patient's surgical dressing becomes soaked with blood? The correct answer is option D, reinforce the dressing and inform surgeon. Question number 59. Which surgical instrument is used to cut delicate tissues? The correct answer is option D, medicine bomb scissors. Question number 60. When should a nurse perform surgical hand washing? The correct answer is option C, before putting on sterile gloves. Question number 61. What is the main function of a suction machine during surgery? The correct answer is option A, to remove blood and secretions from the operative field. Question number 62. Which instrument is used for cutting wounds in orthopedic surgery? The correct answer is option A, bone saw. Question number 63. What is the nurse's first responsibility when receiving a post-operative patient? The correct answer is option A, check airway, breathing and circulation. Question number 64. Which solution is commonly used for cleaning surgical wounds? The correct answer is option A, normal saline. Question number 65. What should the nurse ensure before giving a pro-operative sedative? The correct answer is option A, consent form is signed. Question number 66. Which surgical position is used for abdominal operation? The correct answer is option B, supine position. Question number 67. When should the nurse assess for pain after surgery? The correct answer is option B, regularly and as needed. Question number 68. Which step is essential before inserting a urinary catheter for surgery? The correct answer is option A, putting on sterile gloves. Question number 69. What should be done if a sterile gloves touches a non-sterile surface? The correct answer is option B, replace the gloves immediately. Question number 70. Which vital sign should be monitored most closely during anesthesia? The correct answer is option B, blood pressure. Question number 71. Which instrument is used to hold the edges of a wound during suturing? The correct answer is option C, forceps. Question number 72. What is the primary purpose of using sterile gloves in surgery? The correct answer is option C, to prevent contamination. Question number 73. Which type of surgery involves removal of a diseased organ? The correct answer is option C, curative surgery. Question number 74. What is the most reliable indicator of post-operative bleeding? The correct answer is option C, falling blood pressure. Question number 75. Which of the following item must be verified before surgery begins? The correct answer is option C, correct patient and procedure. Question number 76. Which surgical procedure is performed to remove the appendix? The correct answer is option D, appendectomy. Question number 77. When assisting in orthopedic surgery, what instrument is used to hold bone in place? The correct answer is option D, bone clamp. Question number 78. What is the immediate nursing action if a surgical patient shows a sign of shock? The correct answer is option D, elevate the legs and inform surgeon. Question number 79. Which of the following help prevent infection in a post-operative wound? The correct answer is option D, using sterile technique. Question number 80. When transferring a patient after surgery, what should the nurse ensure first? The correct answer is option D, airway is clear and stable.